Majina naitwa Magege Mnyerilo Venance, ni afisa mifugo kata ya Magomeni, wilaya ya Bagamoyo. Tuna mifugo mingi, tuna jumla ya ng'ombe 57,000 na mbuzi 15,000 na kondoo 3,700. Ugonjwa wa homa ya bonde la ufa kwa kitaalamu unaitwa Rift Valley fever, kwanza unasababishwa na virus inaitwa Bunyaviridae. Huo ugonjwa unaenezwa na umbu. Kuna umbu aina ya Culex na Audes.
Rift Valley fever, also known as RVF, is an endemic disease in the region. The region trades a lot in livestock and livestock products. In addition to that, there is a movement of people within the region, and knowing that Rift Valley fever is a priority zoonotic disease, we need to have a regional approach in tackling the disease. The RVF DST is a very key innovation in addressing and responding to RVF. It's a near real-time early warning tool, and it provides evidence-based approach in planning for preparedness and response to RVF.
Since we are now in the epidemic period of Rift Valley fever, we can use the historical data of Rift Valley fever that happened in the past. We can also use the data from satellite or the climatic change, environmental change from the previous time that the Rift Valley fever has occurred. We can predict in 3 months to come what will be the burden, how likely the risk will be for the coming Rift Valley fever.
The Rift Valley fever DST, it also help to support what we call a risk-based surveillance. As you know, we have a huge country and we have limited resources. So since the DST provide what we call a hot geographic areas, so it will help the ministry and the Directorate of Veterinary Services just to know where to focus on the surveillance based on the science and the evidence provided from the tool.
The RVF DST utilizes the climatic data and environmental data plus the surveillance data to inform on the risk of RVF in a particular area. By doing sampling here today, we are able to confirm, at least by serology, whether we have circulating antibodies for RVF in this area. So if we incorporate and integrate it with climatic and environmental data, we are able to precisely predict whether we are going to have RVF in this area.
Tukipata taarifa za mapema za huu ugonjwa kwamba unakaribia kwenye maeneo yetu, ni rahisi kuwasiliana na maafisa mifugo wenzetu na kuweza kuwaelimisha wafugaji kwamba huu ugonjwa kwa sababu unaenezwa na umbu kwa kiasi kikubwa, na umbu anazaliana kwenye sehemu za majimaji. Kwa hiyo itakuwa ni rahisi sehemu ambazo zina mashimo yenye majimaji kufikia, na sehemu ambazo zinaweza kupuliziwa dawa na yale madimbwi kuweza kupulizia dawa ili kuweza kuepukana na huo ugonjwa.
We have observed and seen that where the tool has been adopted, there were actually the possibility to follow up on the ground, so be more responsive or identifying the risk at early stages. So they could conduct risk-based surveillance and allocate resources in areas that were actually at risk. So this is very important in